Today we are going to discuss about neuroblastoma. Any idea? So neuroblastoma is a type of cancer that arises from the nerve vessels. So nerve vessels are our whole body to migrate throughout our body and mainly in the spinal cord and the spinal nerve on both sides of the spinal cord. Nerve vessel cells. So immature nerve vessel cells will aggregate in any of the part of our human body, and that is called as neuroblastoma. And other tumors of the teacher, the immature nerve vessels aggregate in any part of the body, rather majorly some part of the body, and affect the nerve cells, and it may immature nerve vessel cells will aggregate in any one part of the body or some parts of the body, and it will convert into the tumor cells. Another tumors is what? Aggregation of some cells. The cluster of cells grow out, that is called as tumors, cancer cells. So likewise, in the nerve vessels, the spinal region, the spinal nerves or nerve cells are nerve vessels. It is mostly found in infants or sometimes in the child's above or below the age or average of 5 years, and mostly it was found in the infants. Infants, newborn babies. So how do we get in the newborn babies only we may find the immature cells. Okay, so this mostly will be found in the sympathetic chain ganglia in both sides of the spine and spinal nerves, spinal cord and the spinal nerves, and in the adrenal medulla, this adrenal gland, adrenal medulla, these nerve vessels will be formed. Okay, and these immature cells not only in the spinal cord, adrenal medulla, it also forms in the abdomen of the newborn babies, chest of the newborn babies, and neck of the newborn babies, and also sometimes in the bones or bone marrows, and it may damage the bone marrows. And abdominal, how can we diagnose with the result present in the abdominal stimulation? Through abdominal scan or CT scan, and the symptoms may swelling in the abdomen. Abdominal swelling in this application, if we diagnose, sometimes it may related to the nerve vessels damage or immature cells aggregate in the abdominal portion. Likewise, in the abdomen means this abnormality is happening to gene mutation sometimes, or the abnormal cell growth is due to the mutation in growth regulating hormones like MIBG, ACK, FOX2B, growth hormones for the infants. In the mutation or in the growth hormones, if as deficiency appears, this immature cells will grow out of the chances in there. And coming to the so coming to the clinical manifestations and the symptoms, maybe it is chest application, chest results grow what will happen is breathing trouble will be getting other the baby or the 5-year-old child or someone who is affected with this neuroblastoma, they will be having the breathing difficulty, and abdominal pain and the urinary bladder and the bowel movement will be getting affected. And if it is in the neck, they will be affected with corner syndrome collectively. They will be having small pupils or one side eyelid with the low side of the thumb, or sometimes only one side of the face will be getting sweaty. There is collectively called as corner syndrome. When it is affected, it means the nerve vessels accumulated in the neck region. And sometimes bones there, sometimes it may get affected. Up and down, bones will be getting more brittle, and even they are having the risk factors of fractures. Okay, and their bone marrow begins to get affected. Coming to the diagnosis part, lab application, it is they hormone test. One that is sympathetic hormones, adrenaline metabolism, pancreatic acid in மாதிரி hormonal test எடுப்பாங்க. Okay, due to this, if there are hormones or deficiency, then they will conclude that we are having neuroblastoma. And the urine test and abdominal CT scan. The newborn baby or infant is having swelling abdominal scan or ultrasound and CBC, complete blood report against human. Okay, they will take blood test, the complete blood report, and PET scan, MIBG. These are the diagnosis for the neuroblastoma. And coming to the treatment part, for cancer adrenal, we will be having only chemotherapy, radiotherapy, and surgery. Sometimes, if it is heavy, others in some infants, neuroblastoma will occur and it will go by their own way. They go under observation, it will go, or sometimes they will be giving the medicine, the pharmacological treatment. They will be giving the drug naxitabam. So when they are giving, it will go by their own way. But sometimes there is no other option. If it is heavier or it is seen in the 5-year-old child or something, they want to undergo chemotherapy followed by sometimes surgery followed by chemotherapy followed by radiotherapy. Okay, so this is the treatment for the